Okay, so in the introductory video, I went over what breast implant illness is, and we'll go over that in a little bit more detail. But what is it not? Well, there's a couple things that we need to address just to kind of create some distinction between those and breast implant illness. So first of all, we already talked about the capsulectomy. Well, what else do we do capsulectomies for? Capsulectomies traditionally were done for breast capsular contracture. So anyone with breast implants, whether it's for cosmetic purposes or reconstruction, has a risk of getting a capsular contracture. Now, if they had, let's say, a problem after surgery, an infection or a bleed or something like that, a hematoma, then they're going to have a much higher rate of capsular contracture. Capsular contractures is not as common as it used to be. But nevertheless, it is a well-known, non-controversial thing that every plastic surgeon has encountered. It's basically when the capsule around the implant, which again is sort of what the body lays down, this, think of it as a bit of a scar layer, a collagen layer around the implant. If that gets thick or contracts or calcified, and it will tend to contract as it gets thicker, it can cause problems. It can create distortion and even pain. So taking that capsule out and then typically replacing the implant and maybe placing the implant in a new pocket. In other words, if it was below the gland and above the muscle, now putting it below the muscle. That's kind of the standard of care for capsular contracture. And again, it's, we've all seen it. Folks that have it are more susceptible of having it again, but nevertheless, we've seen it. And typically someone who's got a significant capsular contracture, like what's called a grade 3, or where it's distorting the breast, or grade 4, where it's also causing pain, we're removing the entire capsule, okay? Which is interesting because we're removing the entire capsule, changing the implant, and putting it in a new pocket. The reason is that doing those maneuvers tends to minimize it happening again. So one thing that can be looked at as kind of a parallel is that surgeons are intent about getting that whole capsule out, just like in BII. So something there is triggering the body to form the capsule. But typical capsular contracture, we're not implying that there's systemic problems like there is with breast implant illness. Here's another issue that you may be aware of or seen in the news recently: breast implant associated anaplastic large cell lymphoma. So that is a cancer. It's a lymphoma cancer. It's not a breast cancer, but it happens, it occurs around the capsule. And it's well known. It's getting a lot of research, a lot of press. There's been about 800 cases in the world, some deaths. And it's only ever been associated with textured implants, primarily in the US, Allergan textured, because they're kind of an aggressive texturing, a coarse texturing. It doesn't seem to happen so much with the Mentor or Sientra, kind of a mild or micro textured implants. So the cause of it is somewhat controversial. There's various theories. But it's not controversial that it exists. Everybody knows that it exists. It's not like breast implant illness where the controversy is that, does this even exist? So with ALCL, no, it definitely exists. It presents completely different than BII. So most patients with ALCL are, okay until they have a problem. And that problem might manifest as a swollen breast, a seroma, a fluid collection around one of the breasts, and usually several years down the road. It's not an early thing. I think the average is like 8 years after surgery. And there's a whole protocol about what we as plastic surgeons need to do to diagnose it and ultimately treat it. For most patients, it's easily treated with complete total capsulectomy, typically done as an en bloc capsulectomy. So I hope you have some understanding about what BII is and how it's different from ALCL or capsular contracture. We're doing capsulectomies for all these procedures, but the pathology is different, the indications are different, the surgery might be a little bit different. I think for ALCL, certainly that topic deserves a whole series of videos. So that's another topic, and it's an evolving issue in plastic surgery, and we're all kind of keeping ahead of it, trying to stay learning and learning new things as I'm sure you are. But again, it's not the focus of this series of talks on BII. So stay tuned for more on breast implant illness.